just wanted to give a little bit of a Friday update. So happy Friday to you wherever you are in the world. Tim had an oncology visit this morning, and every Friday he goes in and they draw his labs, and then they give him a Teclistamab shot, which is the trial drug he's taking right now for his multiple myeloma. And his numbers came back low, meaning that his neutrophils were at around 250. Normally, over the past few times, they've been hovering around the 500 mark, which is better. Normal neutrophil range is around 2,500 to 7,500, so 500 is still very low. 250 is dangerously low, and it's not safe for him to have a shot because the risk is that it'll bring his number down even more. So one of the side effects of Teclistamab we are finding is that it definitely, like all chemotherapy drugs, compromises your immunity. He also, during the stem cell transplant, that process basically wipes out your immunity because it clears out all of your childhood vaccinations and the immunity that you built up over the course of your normal life. So the risk right now is that he would be, he kind of is neutropenic, but he's a little bit febrile, meaning that he's got a low-grade temperature. He's had some loose stool, which is a part of, or a side effect of Teclistamab. He's had some numbness in his toes. So if you are, looking at the possibility of taking this drug, or have a family member who might be looking to take it at some point, just know that these are some side effects to the drug. The upside is that it really did wipe out his cancer numbers. They'll redraw his numbers next week, so we'll find out, more specifically where he's at. His numbers were at 31 last week, or last month, and we were informed that 28 is pretty much remission level. Again, multiple myeloma doesn't officially go into remission. He will forever have it unless, some other kind of miracle happens. We've seen many thus far, so it's possible. But he will, at least pursuing this route of treatment, he'll need to continue with some kind of treatment in the form of chemotherapy or immunotherapy. So I guess the upside, like always, is it's better to know what you're dealing with and why than to not know. He's felt pretty crappy this past week, and I think it takes an emotional toll on him as well, because when you're starting to feel better and then all of a sudden you feel not so good again after years of not feeling well, it's just a little disheartening. So at least now he knows why, and we know why. He's been extremely tired. Sleep has been hard. He's waking up sweating and then freezing and then sweating again. Oddly, these are things that he's been dealing with for years, kind of silently. So yeah, but his spirits are good. His attitude is positive, and that's great. And then he has hard moments, but as do all of us. So I think the final parting thought or feeling I'd like to share is just, I'm still constantly grateful for things that were hidden to be out in the open, so that we can be talking and relating around what is and what's real, and just take it as it comes and try to find our way through it, but together, because we know what it is. We know it's cancer. We know it's multiple myeloma. We have a support team and a treatment team, and that really makes all the difference after years of him suffering kind of silently through chronic pain. And with this round, I said I think it's just a constant reminder that if you're feeling like crap, like keep going until you find out why. Because there's something going on. And there's all kinds of reasons why one might not feel well. And it can be on all different levels of who we are as human beings. He had addressed all the levels. And I'm just grateful that we discovered it was on this level that he wasn't doing well. And I would say emotionally and spiritually, he's doing really well. So that's, and our relationship is doing well. So there's a lot of different ways we can thrive as human beings, even in the midst of hardship. And I'd say we're thriving on many levels. And, his body's dealing with some continued hardship. And I think that's it. So happy Friday. Thanks for being here. And if you have any questions, definitely message me. If you have comments, I'd love to hear.